What would keep such disturbing behavior going on?
Well, actually, you might say that there are dynamics of attachment to sex that are built into the process of addiction. And actually, I could talk a little bit about, I think, the three major dynamics, which would be a physical dynamic, a psychological dynamic, and also a spiritual dynamic.
Okay, then tell us about the physical dimension of attachment to sex.
Okay, the physical dimension would be, let's say you have a person who started a sexual addiction, and the nervous system will then interpret or consider the arousing explicit material as a stress to the nervous system, and actually will try at some level to calm down the nervous system, which is being aroused by this kind of unusual material. Then what will happen is that the brain and the nerve cells will actually, when faced with the explicit material, which is not stopping, actually try to tune it out, and may even consist of the nerve cells becoming less welcoming, even physically less sensitive and responsive to the material in an attempt to kind of block it. However, that's not the end of what happens in terms of the nervous system. Unfortunately, the nerve cells then at some point, when faced with the bombardment of the sexually arousing, repetitive material, will actually get to a point of kind of, if you can't beat them, join them. And so then there'll be a process of accommodation so that the nervous system at some level changes structurally and functionally to accommodate the habit, which is a very sad state of affairs.
What about the psychological dimension of attachment to sex?
Okay, the psychological dimension at some level relates to an escape from pain. If a sex addict finds himself getting angry or feeling guilty or ashamed of what is going on in his life, he might find that he's tempted to look at pornography or to fantasize. And in this process, what will happen is he might then try to seek gratification by actually perhaps going to a bookstore or perhaps visiting a prostitute in an attempt to, again, feel normal, but actually it's not a state of normalcy that he returns to, and the whole cycle of addiction and the rituals with it begin again.
Dr. Mari, you mentioned the spiritual aspect to attachment to sex.
Yes.
What do you mean by this?
Okay, actually, what I'm talking about is our fallen nature and the tendency that we have as human persons to do what's wrong and to actually rebel against loving ourselves, loving God, and loving our neighbor. So a sexual addict is really engaged in repeated mischief, and he becomes, you might say, sexually self-centered. I mean, he's really centered on sex rather than worshiping our eternal God.
What is the difference between the sexual thoughts and acting out of an addict and the behavior of a person suffering from obsessive compulsive
Disorder, yes, you mean OCD,
yes.
Right? Okay, well actually that's a bit of a complex question. What I can do perhaps is just begin by saying that the person who's suffering from obsessive compulsive disorder is actually experiencing thoughts and behaviors which are actually not under the control or the guidance of reason and will. But in the case of a sexual addict, you'll find that his decisions are from the beginning, that is, the decisions to act out sexually are free and voluntary decisions, so that there is a contrast there. Also, in the person who is obsessive compulsive, he will often be in a position to be perhaps repenting of sins which he thinks he's committed sexually, but in fact he has not. While in the case of a sexual addict, there's a certain quality of a lack of remorse. To a certain degree, when you put the two together, you'll see that the person who's truly suffering from an obsessive-compulsive disorder really is pursuing holiness. He is someone who would really like to have this behavior stop because he feels that it is offending God. While, on the other hand, the sex addict is someone who actually, at some level, has a certain delight for the sexual inappropriateness that he's engaged in and actually has a taste for it. So these types are very different, even though on the surface you might say, well, they're engaging in the same behavior, but actually they're really two different kinds of syndromes.
So are you saying that not all inappropriate sexual behavior is alike?
That is correct. And a good mental health professional will be able to determine whether a given sexual behavior is truly a sexual addiction to an immoral sexual behavior, or whether a sexual behavior is actually a symptom of a deep psychological disorder, which is commonly known as obsessive compulsive disorder. And actually, it would be a great service for a lot of persons who are hurting in either category, sexual addiction or obsessive compulsive disorder, to really know and understand the nature of their problems.